I'm Dr. Pavan Kumar, surgical gastroenterologist and colorectal surgeon from Yashoda Hospitals. Fistula medically is an abnormal connection between two structures which should not normally exist. When we say perianal fistula, this connection is between the last portion of the intestinal canal, what we call as an anal canal, to the external skin. There is a bridge which forms through which bacteria leak and causes the pus formation. This itself is called as a fistula. The most important cause for fistula is constipation and repeated staining while passing stools. Patient usually asks us what leads to fistula formation. When we look at the causes for fistula, fistulas are basically divided into primary and secondary fistulas. The primary fistula is defined as whenever we call a primary fistula when patient comes to us with a fistula and rest of the anal canal doesn't have any other disease. This is called as primary fistula. And in these patients, fistula itself is a problem. So why does a fistula develop in these patients? The main reason for these patients to develop fistula is repeated staining while passing stool, constipation. The main reason for constipation is lack of fiber in the adequate fiber in the diet. So patients, when they repeatedly strain or when there are a lot of abnormal bacteria which develop in the anal canal, then because of the excessive straining, this bacteria spread outside the anal canal. There are certain anal glands surrounding the anal canal. These produce a mucus jelly-like material to lubricate the passage of the stools. When patients repeatedly strain while passing stool, repeatedly exerting too much pressure while passing stool, what happens is because of the excessive pressure, this bacteria spread outside and infect these anal glands. And then these anal glands develop into a perianal abscess. When this perianal abscess ruptures outside, this forms a bridge which forms the perianal fistula. Depending on how long the history of fistula is there, depending on how long the disease is going on, the depth of fistula varies. So patients usually present with the usual symptoms when the patient present is usually they complain of some swelling developing around the anal canal, which is usually painful, and then they usually tell that there's the swelling which ruptures and then discharges pus. Because perianal fistula is an infective process. Most of the time when patients come to us with perianal fistula, most of the time the diagnosis is quite clinical. Patient usually come to us with the following complaints. Usually they complain there is a swelling which develops surrounding the anal canal which ruptures and discharges a pus. And this process keeps happening. At the end of the time, they notice a small opening outside the anal canal, surrounding the anal canal, which keeps draining the pus discharge. Some patients don't actually observe the external opening. They usually complain of pus discharge while passing to the stool. Some patients complain of itching. Some patients complain of actual pain while passing stools. When we suspect a fistula, the initial clinical examination will give us a diagnosis. When we suspect fistula, we need to confirm it with an imaging diagnosis. Usually, it's either an ultrasound scan or an MR fistulogram. Ultrasound scan is the usual screening test which we do to establish whether there's a fistula is there or not. Suppose patient comes to us with clinical features of fistula and we demonstrate that there is a fistula, then why do we need MRI in these patients? MR fistulogram is more accurate than ultrasound scan. Its advantage lies in that it is much more sensitive than ultrasound scan. Suppose a patient comes with clinical history of fistula and ultrasound is not showing any diagnosis for us, MR fistulogram helps us. The second situation where MR fistulogram helps us is patient comes to us for fistula, we are planning a surgical procedure in these patients. MR fistulogram acts as a map. It guides us because most of the treatments in fistula now are minimal access treatment. The laser ablation or WAFT, all these things, we need a precise location of the fistula, the depth of the fistula, the location of the internal opening, all these features, all these facts are given properly in the MR fistulogram. So MR fistulogram helps us in planning the treatment for these patients to make the surgery more effective and less painful. Thank you.
Like, comment, and subscribe for more health updates.